Alrighty. Hi everyone, my name is Kristina Benjamin. I work in the Senator Brouk's office as her community outreach and constituent manager. Today we're here to talk more about Black maternal health. During this week, it's Black Maternal Health Week, and I'm here and I'm joined by Dr. Ayesha Turner. Thank you so much for being here.
Thank you for inviting me.
Absolutely. And so we could just jump right into it.
Perfect.
I will give you a chance to introduce yourself and tell us a little bit more about what you do.
Sure. So my name's Ayesha Turner. So I was born and raised in Brooklyn. And ever since I was 5 years old, always wanted to be a doctor, never wanted to be anything else. From the moment that I hit high school, I knew that I wanted to be in women's health. Just feel like a lot of women are looking for people who, are the same as they are. We go through the same things. They're looking for a little bit of camaraderie and some understanding. And I realized that there was a real disconnect with how women's health has been managed in general. So it's always just been a passion of mine. But I left New York, went to residency in Buffalo, and I've been in the Western New York region ever since.
Welcome to Western New York.
Thank you. And recently moved to Rochester and absolutely love it so far. So just glad to be a part of something great.
And where are you working right now? Where could our constituents find you?
Yeah, right now I work for Highland Women's Health. So that's right out of Highland Hospital. I have 2 office locations, one that's kind of out in the Pittsburgh location, but my main office is right at Highland Hospital. So they could always find me there.
And Pittsburgh is actually a part of our district, so that could be helpful for our constituents.
Awesome.
So let's talk about it. Why do we need Black Maternal Health Week, and how do you see the importance of Black Maternal Health Week in your practice and the issues you work on?
Sure. I really think that Black Maternal Health Week needs to be more like a Black Maternal Health Month. It is a very
year. I mean,
oh yeah, right. It's a huge issue. Part of it is already just starting off. Maternal health in the United States already is really not doing great. Our maternal mortality rates keep going up, and we're not doing a great job of decreasing those numbers. But a substantial amount of those numbers happen to be Black women. So we continue to try to figure out what the disparity is in that window, and we keep focusing on that. And why we need that here is because we still haven't closed the gap enough. It's still a constant issue. And so if we didn't have this week, we would never be focusing on the issues at hand, and we would kind of be brushing over something that every single year we'd notice is worsening and worsening.
And so in the United States, Black women die from pregnancy-related complications anywhere from 3 to 4 times the rate of white women. And that's no matter how much money they make, how much education they have, where they live. I actually learned the other day with another expert that those rates might even go up higher with the level of money and education you have, which was so surprising to me. So what are some of the high-risk conditions and pregnancy-related complications Black women should know? I mean, I hear preeclampsia, eclampsia, hypertension, and I'm like, but I wouldn't even know I don't know what I'd be looking for in me personally. So what are those warning signs to even know?
Those are really great questions. And you're entirely right. Preeclampsia is probably the biggest one that we see the most. Typically, you see it during pregnancy, but it can happen at any portion of that time. So during the pregnancy, right after delivery, immediately postpartum, 6 weeks after. So it's honestly a constant kind of issue that we need to pay attention to. Many times we tell people to pay attention to a really worsening headache that's not improving with medication, having changes or blurriness in your vision, having some swelling in locations that's not normal in pregnancy. So in your face or your upper body would never be a normal place to retain fluid or have any kind of congestion. So we always make sure that our patients are paying attention to that. I've been trying to give some of my patients prescriptions to get at home blood pressure cuffs, because what we're noticing is that when people pay attention to those, or they have a sign where they say this headache is really getting worse, they can have someone take their blood pressure if a loved one is at home and already know, okay, I'm in a severe range and I need to get to a hospital.
That could be helpful. I mean, they're big words. You're not familiar with them, but you hear these statistics, and you just don't know what that's going to feel like personally as you're living in your body.
Of course.
I wanted to talk a little bit more about pregnancy loss and what that may look like for Black women. So research shows that Black women experience all types of pregnancy loss, including miscarriages, stillbirth, preterm birth, infant death more often than white women, and Black mothers are more than twice as likely to experience stillbirth compared to Hispanic and white mothers. Why do Black women experience more pregnancy loss?
So I actually did a master's in public health many moons ago, but it actually was involving this entire topic. A lot of it has to do with just the inherent stress of being a Black woman in the United States and the amount of the kind of discrimination and racism that we undertake on a regular basis that we kind of just strap on our backs, carry it with us, take it on, and just kind of keep trucking. And it's really something that we've learned to almost think is normal. And so we just encompass this amount of like internal stress. And because we don't really find a release to be able to talk to someone to discuss that, have therapists that we can reach out to, and even times just because Black women tend to be, the major pillar of their family. They have to be the strong ones. They have to be the ones who, make sure their family is all in one unit.
Almost trendy. It's like, cool. It's like that strong, independent Black woman, but that can be tiring and certainly weathering on your body.
For sure. And I think we think that's more of like a badge of honor, but it really has a huge deterioration on how our body functions. And a lot of that we inherently hold on to in the midst of trying to carry a baby. And, I had read this really great article about how could that be a womb that is protecting your growing baby when you're holding on to this amount of like constant stress? It's not a safe place. Can't carry a baby that way. And so when we carry that kind of stress, I think it just adds to how we function in the rest of our lives and our health.
Some of this is like, sometimes it seems and it feels disheartening. And I'm young and I haven't experienced this before, but you hear stories about it. And many women have difficult times coping with this feeling of loss and disappointment. If you're angry associated with miscarriages, and I know haven't gone through all of Becoming, have had it for a very long time, Michelle Obama's book, but she described having a miscarriage as lonely, painful, and demoralizing. And so what advice would you give to a Black woman, a Black person, a couple, a Black family that is trying to cope and heal from pregnancy loss?
Sure. I would really tell them to really just allow themselves to just be vulnerable. It's okay to be angry. It's okay to be sad. It's okay to just really feel like you're just not in a good place at those times. I feel like you have to allow yourself to really be able to heal. And a lot of that healing has to come from, really getting and understanding that hurt. I think a lot of times we try really quickly to just recover. It's not that type of feeling. You have to actually be able to feel that pain and sadness and allow yourself to be able to say that I know this is not something that I want to happen again, but I know that I'll be able to move forward with this once I heal fully. But you have to give yourself time to really be able to understand what happened and be able to really let your wounds really recover.
And where can they turn? Because through my research, I saw that Black women are also less likely to not only receive like mental health care, but even seek it, because you are internalizing these emotions and you do think that you just have to, just have to be that strong woman, and it's not okay to seek care, or you want to keep it a secret. So where should women turn to?
Yeah, I really feel like a lot of it has to deal with what your healthcare system looks like. I'd like to think that I keep a really open door policy when it comes to my patients. If they ever have any kind of concerns, they don't have to answer to anybody. If someone just says, Dr. Turner said I could be seen in a week, it's non-negotiable. I want them there. I want them to show up. I want it to feel like you have a safe place to land. You don't have to tell everybody your private business. I really do feel like the biggest issue is that you need people to know that this is not an easy thing to navigate. So what I've really started doing is trying to make sure that my patients have visits earlier. We used to be really hard and fast about like, well, we'll see you in a month or we'll see you in 6 weeks. That's just too far away. And so in between that time, I think a lot of Black women, especially, they'll go, I'll just wait the month. They don't really feel comfortable saying, I think I need something sooner, or I feel like I'm not okay. So when you make those extra steps to say, I'll see you next week. If you say you're going to see them, or if you say, I want to see you, I think it gives more of this comfort of saying, well, if they say they want to see me, sure, I'll go. Or like, it makes it feel like it's a little bit more like, I'm saying it's safe to do it, and it makes it a little more comfortable.
And so on that topic, how can Black women and pregnant people advocate for themselves, or what are some good tips for building strong relationships with their healthcare providers?
Yeah, I think the first step is honestly being completely open with who your healthcare provider is. I just realized from experience with a lot of my friends and relatives, they will have physicians, they'll have nurse practitioners, whoever they're seeing, and they'll ask me, does that seem like that's a good plan? And I'll go, I want to give them advice, but I also realize that some of it is because they don't feel comfortable with that provider. They don't feel like they can ask questions. They don't feel like they can question anything about what the plan is, or even say, hey, can I look that up before we start that medication or before I see you next visit? So I think a lot of it is, first, you really have to be open and upfront about what you're looking for. It's okay to go to your provider and say, what do you think about these Black maternal health rates? Ask them, because their opinion will let you know where you fall in that realm of what their belief system is. Because if they either blow you off and don't give you an answer, or if they make light of it and say it's not that big of a deal, how that healthcare system is going to take care of you. A lot of what I think is really important too is, how is the staff in that office? So, I always speak to my office staff and say, they're the first people who see the patients that I see. So if they are really disrespectful, if they don't make it a comfortable place, my patients don't want to come back. So it's got to be this completely cohesive unit. Your nurses, your mid-levels, or your APPs who are nurse practitioners, and everyone else who's working. We're a team. We need to work together. And if patients feel like it's not complete, they're not going to come in and see you in the office.
Yeah, I think that's true. I wanted to just echo what you said before about, and this could be true for everyone, but as Black women too, where you feel as though you should just be happy with what you're given. So if that's what your doctor said, that's what you'll do. And I'll see you in a month, or I guess I'll see you once a year, because you only need to come for an annual visit or something like that. And so through these conversations this week, I've learned that I want to find a provider who I can depend on to be my doctor throughout the year, and not to be bounced around and juggled between multiple different nurses or doctors throughout the year because she's busy. So this time you can see this doctor. So that's my call to action. I'm like, I'm going to go find myself a reliable doctor.
Awesome. That's the first step.
Yeah. And so going back to these disparities that we're talking about, so Black women are more likely to experience pregnancy loss. They're more likely to experience pregnancy-related complications. They're less likely to seek out mental health care in the postpartum period. What are some of the solutions that you see to alleviating these disparities?
Sure. I'd like to say that the first real step that at least I know that I'm doing on my own is that I think what makes it a little bit easier, and different patients feel different ways, but I think when patients see that I am them, I look like these women, I am these women, it doesn't matter what my educational level is, because that doesn't change the disparity. It's actually worse. It gets almost 5 times as high that the disparities can be with the pregnancy losses, with the low birth weight babies and preterm deliveries. So I think when you also can share in that concern, I think people first feel some comfortability of kind of opening up a little bit more. But even if you're not a Black woman and you're of any other ethnicity, I think first, the way to kind of decrease the way that these disparities are really presenting is first listening. I just think that we're not doing a great job of just listening to Black women. If someone says something, even if it's not really, we clearly know medical terms and medical jargon, and that's not how patients are going to present to you. That's not how someone's going to describe something. So I think we really just need to spend the time to first listen to complaints and then know how to manage those. So we don't minimize those complaints. We let them know that it's warranted. We let them know that it's safe, and that anytime they have a concern, they can come to the hospital, they can come and have an office visit. And I think that that's the first step to really decreasing all of those major concerns. I think long-term, we'll need a lot of legislature that's kind of going to help us get where we need to
Oh,
be.
this is the perfect place to tell us. Let us
Yes.
know. This is an
I think,
extension of the senator's office.
yeah. I think the biggest part, first of all, is how much time you get after you have your baby. I think that we are doing a really poor job of how that postpartum management goes, because 6 to 8 weeks to get used to recently having a baby, healing from a vaginal delivery or a C-section, that's like no time. You blink and you're back at work, or you have to feed your family. Of course you're going to go to work. It doesn't matter that you feel depressed, may not have a extremely supportive partner, maybe your family doesn't live nearby, you're doing this on your own. So I think we first need to figure out, how do we make that postpartum period more manageable? Do we create more house visits? Do we create more office visits? I know when I was still in New York City, they had some affiliations where they would kind of get to the families and find out, what do they need? Do they need diapers? Do they need formula? But they'd make home visits. Clearly with COVID, I know that's not as easily possible. But I think we need to get back to kind of extending that and making sure that people know that someone's checking in on them periodically. But aside from that, I just feel like we really need to kind of hone in on what do people need and how do we get them aid even while they're still currently pregnant. I feel like the only aid we really offer is, really WIC. And outside of that, I haven't seen a lot of opportunities to really get people the assistance they need as they're developing fetuses. So it's important that they get those aids
that are beyond community-based support, but something that comes from the government. So I hear you on that one. And so we've spent a lot of time this week, obviously, talking about the journey to motherhood and of motherhood. But what about the women, and the Black women in particular, that don't want to have kids by choice? Like, what if that is, what if you don't want to have children, and how can Black women express that choice to their healthcare providers? And then where the pressure usually comes from, how can they express that choice to their family and friends?
Yeah, I think honestly, in many cases, I feel like for some Black women, it can actually be harder to tell your family and friends that you don't want to be childbearing. I think some people are just under the assumption that if you are a woman, you will just at some point bear children. I think what really is most important first is telling people what you see as your goals. Everyone has different goal settings, and everyone has certain windows of when they want those goals to happen. So if you really feel that way, the first thing you tell your family is, my passion is XYZ. And I feel like to best be that person or have that goal, I would like to do that without children, or I feel happy about seeing everyone else and being around your children and loving your babies, but I don't personally see that as a goal for me. I think that we get fearful of saying that out loud because we think we're letting go of an opportunity that someone else might have wanted. And I think if we're open about that, everyone has that right to use however they want to use their body. If they want to bear children, if they don't, that doesn't make it that you've somehow made yourself useless. It's still functional. Having a uterus doesn't mean you have to carry a baby. So I think a lot of it is just really being open with your family and friends. In terms of with your providers, I think a lot of it is how we first entertain that conversation. A lot of my conversation with many of my patients, after I find out, what their orientation is or what their interests are in terms of same sex, opposite sex, however they view themselves and others. Typically I have a conversation about, what are your plans moving forward with this partner? Or what are your plans in terms of this relationship? And you'll find out a lot about how people feel about if they want to have children, if they've already had children in the past. But a lot of it, I think we have to open the door to. Many things I think are kept in private, and clearly an OBGYN appointment is very private. But I always mention to them that whatever's discussed in that room and those four walls, there is no mention of any of this to anybody else, to any patients. You can see a patient and their mom. So, like all those things I think get really, really concerning for people, because they're like, what if you tell my mom about what I feel? But with the safety of saying that, like, whatever you say to me here is just between us, I think it allows a lot to be expressed.
And correct me if I'm wrong, but even if you choose to not have children, or that is not where you are in your life, it's still important to have regular visits with a OBGYN.
Always, very, very much so. You are entirely right. I think a lot of people even, to that same note will say, well, you know, I'm in a same-sex relationship. I don't think I need to be here. And I'll go, no, it doesn't matter what your what your orientation is or what your views are. You still need to protect your body. And there are still things that we want to make sure we're paying attention to and ruling out concerns on.
Absolutely. And so as we close this conversation, what are there any resources or local organizations focused on Black maternal health that you could recommend or that you want to amplify to our audience?
Sure. I think a lot of what I pay attention to is on social media. I think social media is a really great platform to be able to get some learning underway. Not only do I have like certain physician partners that I see on Instagram who are really doing a great job of giving a lot of education, but there's I think it's Black Mamas Matter on Instagram. They really do a lot of posts that like remind people to do things. They'll say, remember to ask your OBGYN about this, or remember to pay attention to that. So they really are trying to be advocates for Black women. And I think that's an awesome, awesome page. I really love that. There's some blogs that I listen, not blogs, excuse me, podcasts that I listen to. A lot of them will give stories and people will talk about their birth experience. I think there's a lot of support in hearing other people's birth stories.
Absolutely.
It's awesome. Some of them are right. And like, I just feel like it's a unity in finding out I'm not the only one who had a birth story like this. I thought it was going to look like this and it came out this way. And then you read it and you go, okay, like I'm reading hers. I'm going to write her a message. It's a really great way to still feel like you have like a sisterhood, even if someone's not right next to you. So I think it's called Birth Stories in Color. And it's a podcast. It's also really good.
Yeah, and we'll make sure to amplify that to our community and our constituents as well. But I just want to thank you so much for taking the time to meet with me and taking the time to help educate me as well as our constituents in our community. It's so important. And yeah, thank you very much.
Thank you for having me.
Absolutely.